Good evening, friends. Welcome to the PANSIGHT webinar. Let me start the slideshow. I assume the slide is visible and I'm audible. Over-diagnosis and over-treatment. If you listen to me carefully, and if you put the knowledge you gain from this session in your life, that will make a huge difference. And you see the word huge difference in your life. It will save your health, money, and you'll have more peace of mind. Always, I show this slide because it is necessary. Facts are facts and will not disappear on account of your likes. People with closed minds and prejudiced minds are allergic to facts and evidence. They will refuse to accept facts and truths. They will strongly defend their irrational beliefs and attitudes. അതിനെയാണ് നമ്മുടെ നാട്ടിൽ പണ്ട് പറയും, ഞാൻ പിടിച്ച മുയലിന് 3 കാല്. ദാറ്റ് ഈസ് ആറ്റിറ്റ്യൂഡ്. ഞാൻ പിടിച്ച മുയലിന് 3 കാല്. അതാണ് നേരത്തെ പറഞ്ഞ പ്രിജുഡിസ്ഡ് മൈൻഡ്സ്. For E mission of PANSIGHT, entertain, educate, enlighten, and empower. Always my webinars are based on FAQ, facts, anecdotes, that is real life stories, and fictional stories, and quotations. I always do a lot of reading and research before giving a talk. There are many books on this overdiagnosis. Overdiagnosed, making people sick in the pursuit of health. So the danger is overdiagnosis will make a person, even a healthy person, sick. How do we harm? Another book. Third one, evidence-based medicine. The doctors, we are trained and expected to practice evidence-based medicine. But unfortunately, nearly 70 to 80% of the doctors, they don't do evidence-based practice. That's an ugly fact. I am not sure whether you have heard this quote. I am dying with the help of too many physicians. That is Alexander the Great dying on the bed, surrounded by physicians. Alexander the Great, he died when he was hardly 32 years old. Have you heard this quotation before? If you have not heard the quotation, put N in the chat box. Okay, that is very relevant. I am dying with the help of, okay, Venugopal, no. Thank you. Okay. So, Rohit, no. I feel good about that because when I'm sharing something new information. So, dying with the help of too many physicians. And what happens when there are too many physicians? The next slide will explain. Have you heard this proverb? Too many cooks spoil the broth. If you have heard, put Y in the chat box. Too many cooks spoil the broth. Yes, thank you, Santoshi. Okay, Rohit. What happens when there are too many cooks? What happens? Multiple people interfering ruins a task. Simplicity is best. Same broth, too many people, one person may say, oh, we'll add some more the turmeric. Other person, no, we'll add the chili powder. Other person say, no, cumin powder. So each one adds. Eventually, it spoils the broth. Is this clear? If it is clear, put C in the chat box. The same way, too many doctors, each one will have a different type of diagnosis. Very same patient, very same condition. And each will prescribe a different medicine. For example, first-hand experience, knowledge. When I was in Trivandrum for 5.5 years, between 2009 and 2015, one of my friends, he contacted me to get a second opinion. You know, people get not a second opinion, that actually it was a fourth opinion or fifth opinion. Okay? And he was not feeling well, and he was taking many. Then I said, what are the medications you are taking? And he said, okay, Jan, I'll read the prescription. I said, no. Is it possible for you to come and bring those medicines with you? Okay, the brand names will be different. Because what the brand name in India may not be the brand name in USA. I told him that bring those medicines. Let me take a look at that one. He was under the care of a cardiologist, under the care of a orthopedician, under the care of a gastroenterologist. 3 doctors. And when I went through the medications, from the gastroenterology for indigestion, he was getting a proton pump inhibitor, PANSIGHT. Cardiologist was treating him for, he had a stent placed, other medications, and from him also he was getting the very same proton pump inhibitor, different brand name. And the orthopedic doctor for the knee pain, he was giving a painkiller, and he was also giving a proton pump inhibitor, a different brand name. So very same drug, 3 different brand names. So he was now overdose. All the side effects of that medicine. Is this clear? If it is clear, put C in the chat box. This is one example of too many physicians. And that one, overdose, drug overdose, is a common problem now. And that is happening more in Kerala. Yes. Why in Kerala? I will explain later, Shangwaji. So, that is one example. The definition of the word diagnosis. The process, I use the word, the process of identifying a disease, condition, or injury from its signs and symptoms. A health history, physical examination, and the tests such as blood tests, imaging tests, that is X-ray or CT scan or MRI, then biopsy from that tissue may be used to help make a diagnosis. Over-diagnosis. The topic is over-diagnosis. Okay, when someone is diagnosed with a disease that would not harm them, or when treatment does more harm than good. Over-diagnosis happens because of over-investigation. Over-diagnosis happens because of over-investigation. And my dear friends, this is a fact. Unfortunately, the medical education, quality of education has taken a nosedive. Many doctors, they don't know how to take a good history. 80%, I use the word number, 80% of the accuracy of diagnosis depends on getting a good history. One, many people, they don't know how to take a good history. 2, what is happening? A doctor seeing 10 patients in an hour. Am I right? If I'm right, put R in the chat box. Hardly giving 5 or 6 minutes Am I right? If I'm right, yes. Right, right. So 5 or 6 minutes, you are not going to get a good history. When you don't have a good history, then what will the doctor do? Immediately order bunch of tests, bunch of investigations. And when those investigations, the results, there will be some abnormality with some tests or outside the normal range. Then what happens? That will trigger more investigations. For example, liver function test, common. I'm giving you common examples. Liver function test, a couple of enzymes called SGPT, SGOT, or sometimes they call AST, ALT. The normal range, usually between 5 to 40. And if it is 50, that is above normal range, most of the time you don't have to worry about that abnormal number at all. You need to worry only if it is at least a 2 or more than twice number. If it is 80 or 100, yes, then you need more investigation. Just a bump. But what is happening there? Now the patient gets anxious. പ്രബുദ്ധരാണ് ജയചന്ദ്രൻജി പ്രബുദ്ധരാണ് അല്ലേ പ്രബുദ്ധനാകുമ്പോൾ എന്താണ് ഒറി പ്രബുദ്ധത കൂടുമ്പോൾ ഒറിയും കൂടും നേരെ ഡോക്ടർ ഗൂഗിളിനെ കൺസൾട്ട് ചെയ്യും abnormal lab result. Dr. Google will give a bunch of different conditions. Now, വന്നു കൂനിന്മേൽ കുരു ആദ്യമേ കൂനാണ് അതിന്റെ കൂടെ കുരു. Now this A also. And always it lists all these common rare conditions. Or it could be cirrhosis, or it could be liver cancer. Okay. How do you even do ultrasound? Now, ultrasound for that marginally elevated enzyme, which doesn't require any investigation. When you do the ultrasound, and you may find a small cyst, that also doesn't require any further investigation. But now, yeah, the radiologist, right, there's a cyst. Then comes what? CT scan. And when they do the CT scan, abdomen, it covers the lower part of the chest also, that CT scan. And in the chest, lung, they may see a small calcium spot. Now the report comes, there is a calcified spot in that lung, advice, CT scan of the chest. Now we go for the CT scan of the chest. Is this clear? തുടങ്ങിയത് എവിടെയാണ്? Unnecessary investigation of LFT, liver function test. And that too these days, all these DDR and Metro, they are offering different kinds of package. Okay, elderly people, senior citizen package, executive checkup package, LFT comes 3,000 rupees and LFT is abnormal. Now, then starts all these investigations. Ultrasound, another 500 rupees. CT scan, another 3,000 rupees. And what about the peace of mind? Completely gone. Agreed? Peace of mind, time, money, energy wasted, and peace of mind is gone. Agreed? If you are agreed, put here in the chat box. Because this is a talk. Nobody will be interested. A doctor will be interested in giving a talk on this topic. This topic. Because of different reasons. I am doing my best to educate and empower you. Never, the take-home messages, never go and do all these lab test, executive checkup or package. You don't need. You don't need. Is it understood? If you understood, put you in the chat box. The moment you get that one done, now you are inviting a host of problems. Okay, thank you, Shanaji and Sanal Kumarji. You are inviting Never, never do that one. And for your information, when was the last time I got my lab test done? Right now I am 70 plus. In the past 25 years, I got my lab test done only 3 times. That too for a specific problem when I had. When I had a specific problem, I got that again. Targeted, not everything. Targeted test. And here, every year I can get all the labs done. My insurance will cover. Annual comprehensive examination and annual labs. The last time I got that was in 2020. Because I have not done for so many years. I just wanted to get a baseline, just to know. And there again, their labs are slightly abnormal, high, low. I didn't care. But what about a lay person, ordinary person? A lay person is a person with no specialized knowledge or professional knowledge about medicine. Lay person will get anxious, will panic. So that is the take-home message. I practice what I preach. I practice what I preach. I was taking care of my father. I took care of my father for 5.5 years. From 2009 to 2014. Most of them, no. If you had a cough, yeah, fever, no labs. No necessity for labs. Unnecessary. Over-investigation. Over-diagnosis. Over-treatment. Clear? Convinced? Put C in the chat box. If it is clear and it is convincing, yes. Thank you, Sanal Kumarji. And look at that and how many people have come. 19. This topic is so important. And people will be sitting and watching some Parata TV channel charcha about what is that water adhikar yatra going on and the tariff war. And that is not going to affect them. It is outside their control. What the America does or what Modi does, it is outside your control. Then what's the point in watching? ചെമ്മീനിനി ഒരു രക്ഷയില്ല കേട്ടാ. എത്ര പേരുടെ ജോലി പോകും, പ്രയാസമാണ്, മനപ്രയാസമാണ്. എത്ര പേരുടെ ജോലി പോകും. നിങ്ങളുടെ ജോലി പോയില്ലല്ലോ, 3 നേരം കഴിക്കാനുണ്ടല്ലോ, കഴിച്ചോണ്ടിരിക്കണം. ആൻഡ് ഇതേപോലെ ടോക്ക് വല്ലതും കേൾക്കണം. Come and listen to a talk which you will never get from somebody else. ഞാൻ നിങ്ങളെല്ലാം പറ്റുന്നത്. I'm glad that is you are. You appreciate the value. You are using your time productively. But look at many people. They are not here. They're so busy watching something useless talks. Am I right? If I'm right, put R in the chat box. With this talk, this Sanal Kumarji, thank you. Okay, Roy Charayanji, thank you. The biggest problem is that overdiagnosis triggers overtreatment, and all of our treatments carry some harm. Before giving this talk today, do you know what I did? I spent more than 10 hours calling my friends, doctors, back home and here also. Different specialty, cardiology, gastroenterologists, gynecologists, ophthalmologists, ENT surgeon, nephrologist, surgeon, and ask them the question, could you please share some real life examples of overdiagnosis and overtreatment? So whatever I'm sharing is authentic. It is not some from the book. It's not bookish knowledge. It's not theoretical stuff. Real life. Just say 20 minutes back, again, I talked to a cardiologist who is in Kerala. who is again 70 plus. And from him, I learned very many interesting stories. Scary, really scary. Healthcare system has become health scare system. Do you understand this? That is my own quote. Care has become scare. Health scare system. I'm going to share more real life examples that would validate that quote. Laymen are suffering from nosophobia. You might not have heard that word. Nosophobia means irrational fear and anxiety of some disease due to misinformation and disinformation from print media, visual media, and social media. Is this clear? This nosophobia? If it is clear, put C in the chat box. I'm going to explain further. Misinformation and disinformation. Misinformation is there's no agenda, there's no motive. Disinformation, deliberately they spread wrong information, misinformation. Thank you, Pradapji. First, those who can read Malayalam, they'll understand. Panikalam, Kollam ജില്ലയിൽ 3 ദിവസത്തിൽ 63 പേർക്ക് ഡെങ്കിപ്പനി. പടമെല്ലാം കണ്ടോ? എന്തിനാണ് ആ ന്യൂസ് പേപ്പറിലെ ആ ഫ്രണ്ട് പേജിൽ അത് കാണുമ്പോൾ പേടിയായി. എസ്പെഷ്യലി ദോസ് ആർ ഇൻ കൊല്ലം. ഇവിടെ പടർന്ന് പിടിക്കുകയാണ്. So even my dear friends, I have told this in the past also. 98 or 99% of the fever, ordinary viral fever, you don't need to see any doctor, you don't need to get any test done. All you need is a rest for a couple of days, kanyim kudiche and some more water, and if temperature is more than 100 or 101, just a paracetamol tablet, fine, it'll be over within 2 or 3 days. But this creates a nosophobia, fever, dengue. Nere odi pidiche, they will go to the nearest hospital. Then they will order dengue matramano, chikungunya ano ennu nokande, adu covid ano ennu ariyande, adu matte പക്ഷിപ്പനിയാണോ പന്നിപ്പനിയാണോ എന്ന് അറിയണ്ടേ, എലിപ്പനിയാണോ എന്ന് അറിയണ്ടേ, എത്ര പനിയുണ്ട്. So they will order all those investigations. It will cost more than 3,000 rupees. And there are 3 or 4 members from the same home. Okay, how much? 15 to 20,000 rupees. And the whole day is gone. You will be in the hospital waiting for the lab results. And when the results come back, they are all negative. Then what do the doctors do? ഒന്നുമില്ല, പേടിക്കണ്ട, വീട്ടിൽ ചെന്ന് കഞ്ഞിയും മറ്റേ ഇത് പാർസൽ അയച്ചു കഴിഞ്ഞാൽ 20,000 rupees I have spent. Then just കഞ്ഞി എന്താ പ്രബുദ്ധൻ, ഞാൻ പ്രബുദ്ധനാണ്, എനിക്ക് അങ്ങനെ പറ്റത്തില്ല. So to please him, antibiotic. They prescribe antibiotic which is not at all indicated. Over-diagnosis or misdiagnosis and antibiotic. And you take the antibiotic, more than 50% of them, they develop some side effects of the antibiotics. Then you take treatment for the side effects of the antibiotics. That is because of the treatment. If you didn't go to your doctor, if you rested at home for a couple of days, you could have saved nearly 20,000 rupees. You get my point? Is it clearly understood? If it is crystal clear, put CC in the chat box. See, because I'm a medical doctor with 50 years of practice experience. You won't, I repeat for the third time, you will never hear this sort of a enlightening talk for anybody else. Okay, thank you, Jaychandraji. തീർന്നില്ല. മലയോരത്ത് ഡെങ്കിപ്പനി ഈ വർഷം 586 കേസുകൾ. കൊതുകിന്റെ പടം ഉണ്ടല്ലേ? കൊതുകാണ് താരം, ഉദയനാണ് താരം, കൊതുകാണ് താരം. ഉടനെ കുഴിതായി. പക്ഷെ പ്രബുദ്ധൻ കൊതുകിന് വേറെ ചെയ്യത്തില്ല. കൊതുകിനെ എലിമിനേറ്റ് ചെയ്യാനായിട്ട് കീപ് യുവർ ഹോം ആൻഡ് സറൗണ്ടിങ്സ്, ഡോണ്ട് ലെറ്റ് എനി വാട്ടർ കളക്ട്. ഇല്ല, അവിടെ എല്ലാം കൊതുക് വളർത്തിയ കേന്ദ്രമാണ്. പ്ലാസ്റ്റിക് ബാഗെല്ലാം ഇട്ട് വെള്ളമെല്ലാം കയറി കൊതുകെല്ലാം പെറ്റ് വരും. എന്നിട്ട് ഒരു ഗുഡ് നൈറ്റ് വെക്കും. ഗുഡ് നൈറ്റ് വെക്കും, കൊതുകിന് കൊല്ലുന്നില്ല. വാട്ട് ദാറ്റ് ഗുഡ് നൈറ്റ് ഡസ് ഇസ് കൊതുകിനെ അവിടെ നിന്ന് വിരട്ടി വിടും. വേണോന്നാരുടെ വീട്ടിൽ നിന്ന് വരട്ടിയിട്ട് അടുത്തുള്ള ജയചന്ദ്രന് പോയി കടിക്കും എന്ന് പറയാം. ആ കൊതുക് നേരെ വേണോന്നാരുടെ വീട്ടിൽ നിന്ന് പോയി ജയചന്ദ്രനെ കടിക്കും. അതായത് സനൽകുമാറിന്റെ അവിടെ നിന്ന് പോയിട്ട് അടുത്തുള്ള കൃഷ്ണാർജുന്റെ വീട്ടിൽ പോയി കടിക്കും. അത്രേ ഉള്ളൂ. ഇതാണ് പ്രബുദ്ധൻ. ആരാണ് ബെനിഫിറ്റ്? ആരാണ്? ആ മറ്റേ ഇതിന്റെ ഗുഡ് നൈറ്റും ആമമാർക്കും മറ്റേ ഹിന്ദുമാർക്ക് ഇതെല്ലാം വിൽക്കുന്നവര്. എലിമിനേറ്റ് ചെയ്യാം. അതിന് സിമ്പിൾ ഇതൊക്കെ ഉണ്ട്. ഞാൻ ഇന്നത്തെ സമയമില്ല, ഞാൻ ഇതിനുമ്പ് ഒരിക്കൽ പറഞ്ഞിട്ടുള്ളതാണ്. ഈ ഗുഡ് നൈറ്റും കിഡ് നൈറ്റും ഒന്നും അല്ല. വെറും ഒരു ചെറിയൊരു കപ്പില് ഒരു കുറച്ച് വെള്ളം വെച്ചിട്ട് വീട്ടിന് 4 ചുറ്റും വെച്ചാൽ മതി. ഒരാഴ്ച ആകുമ്പോൾ അതിൽ കൊതുകെല്ലാം മുട്ടയിട്ട് ലാർവ കാണാം. അതിനടുത്ത് നേരെ മണ്ണിലോട്ട് ഒഴിച്ചാൽ മതി. തീർന്നു. അങ്ങനെ അപ്പുറത്തെ എല്ലാവരും, വീട്ടിലുള്ള എല്ലാവരും സഹകരിച്ച് എല്ലാവരും ചെയ്ത കൊതുക് എലിമിനേറ്റഡ് ആയി. ഇതൊരു മിസ്റ്റർ ജോർജ് ISROയിൽ ഒരു സീനിയർ എഞ്ചിനീയർ ഇത് ഡെമോൺസ്ട്രേറ്റ് ചെയ്താണ്. കുറെ സ്കൂളിലൊക്കെ പുള്ളി ഡെമോൺസ്ട്രേറ്റ് ചെയ്തു എങ്ങനെയാണ് ചെയ്യുന്നതൊക്കെ. വല്ല കാര്യമുണ്ടോ? ഇല്ല. പ്രബുദ്ധരാണ് നമ്മൾ, പ്രബുദ്ധരാണ്. നമ്മൾ അതൊന്നും ചെയ്യത്തില്ല. നമ്മളതൊന്നും ചെയ്യത്തില്ല. സിമ്പിൾ, ഈസി to eradicate mosquitoes. Who benefits from over-diagnosis? 1, pharma industry. 2, labs. 3, doctors. 4, hospitals. Then 5, device makers and counselors, imaging centers, and insurance industry. Is it clear? Is it clear? So over-diagnosis, labs, medication, pharma industry, unnecessary antibiotics. I'm giving you only one example. There are many. Device makers, pulse ox. അല്ലേ? ആ കോവിഡ് വന്നപ്പോ എല്ലാവരും എത്ര രൂപയെന്ന് എനിക്ക് അറിഞ്ഞുകൂടാ. വീട്ടിലെല്ലാം വാങ്ങിച്ച് പൾസ് ഓക്സ് വെച്ച് നോക്കിക്കൊണ്ടിരിക്കും. എത്രയായി? 92, 94, 96. Am I right? Venugopal Nairji? Because when I talk to some people in India and they will ask, രാവിലെ 94 ആയിരുന്നു, ഉച്ചയ്ക്കായപ്പോ 93, കേട്ടാ, വൈകിട്ടായപ്പോ പിന്നെ 94, ഇന്നിപ്പോ രാവിലെ 92. Worry. Devices are sold. So device makers and counselors. പിന്നെ എല്ലാം സ്ട്രെസ്സൊക്കെ ആയി. ഇത് അപ്നോമൽ. പിന്നെ ഡയറ്റീഷ്യൻ, ന്യൂട്രീഷൻ കൺസൾട്ട്, ഡയബറ്റീസിനുള്ളതിൻ്റെയൊക്കെ കംപ്ലീറ്റ് ബിസിനസ്സാണ്. ടെറിബിൾ. Overused unnecessary tests, unnecessary investigations. MRI scan for back pain. 99% of these incidents for a back pain, you don't need even a chest X-ray. X-ray പോലും വേണ്ട. The guideline is back pain, muscle sprain, 4 to 6 weeks. If it doesn't get relieved, or if it gets worse, then you may need investigations. But the moment here, sprain, nerve, MRI scan. Am I right? If I am right, put R in the chat box. Because I have seen that is MRI scan. It costs nearly 7,000 or 8,000 rupees, and the radiation. An MRI scan, if you do, it will pick up some other abnormality. Then you worry about that abnormality. Just like the LFT. Yeah, enzymes are high. And now you worry about that enzyme. Then you do the ultrasound. Ultrasound again something. Now you worry about that. Then you do for the CT scan. Then you find a small calcium spot. Unnecessary investigation. No investigations for back pain guidelines. Evidence-based medicine, how many doctors practice there? I told you, only 20%. 80% immediately. And maybe two reasons. One, ignorance. Because they are ignorant. Or they will get the kickback. MRI scan, you will get, some hospital give you 40 to 50% for the doctor. If it is 8,000 rupees, the doctor gets up to 4,000 rupees. Easy money, quick money. Unethical doctors, if they watch this video, they will be very angry with me. People who are thriving by taking the kickback, they will be mad. They will be angry at me. I don't care. I don't care. Because I am doing this way, my motive is to help the public, educate the public, empower them. I am doing this with a motive of empowering. It's a mission. My personal mission or professional mission, you can call it. Ultrasound for abdominal pain. Hey, abdominal pain, if you take a good history, more than 95% of the people with abdominal pain, you don't need any investigation. Any investigation. When you do the ultrasound, okay, that will catch the liver also. Ultrasound. And the fatty liver. You must have heard. Fatty liver, fatty liver, fatty liver. Okay? More than 80% of the people, they have fatty liver, maybe mild or moderate. Now comes the, fatty liver. You go to a gastroenterologist. A gastroenterologist, he will give you medicine for the fatty liver, as well as periodically, once in 3 months, you go for the test. You have this one, pain. Am I right? Fatty liver is a big business. It's a big business. So that is ultrasound. That over unnecessary investigation. Then CT scan for headache. Again, 95% of the patients with this headache, they don't require any investigation. Because when I was in UK, I practiced in UK for 2 years. Yeah, prostate too, coming to that one. 2 years. And their budget is very tight. National Health Service, government, money. So high price investigations as a senior house officer or registrar, we cannot order. We have to get the consent from approval from the consultant. So we have to convince the consultant why he needs a CT scan. Only CT scan if there is a strong suspicion of brain tumor or vascular hemorrhage or something like that. Otherwise, no. So take a good history, 95% of the patients, no CT scan. That's not what is happening in India now. The moment he comes with a CT scan, CT scan, they don't even examine the patient. Am I right, Venugopal Narji? Or MRI scan, so the whole day is gone. Then CT scan is normal. Patients are unhappy. 3000 രൂപ ചെലവാക്കി കേട്ടാ ഒന്നുമില്ലേ, കുഴപ്പമൊന്നുമില്ലേ, വല്ല കുഴപ്പമുണ്ടെങ്കിലേ സന്തോഷം വരത്തുള്ളൂ. റോയ് MCG 3000 രൂപ ചെലവാക്കിയ സ്ഥിതിക്ക് നോർമൽ എന്ന് പറഞ്ഞാൽ അൺഹാപ്പിയാണ്. എന്തെങ്കിലും കുഴപ്പം കാണണം. ശ്രീകുമാരജി എന്റർടൈൻമെന്റ്, ഞാൻ പറഞ്ഞില്ല എന്റർടൈൻമെന്റ് ഉണ്ട്. എന്റർടൈൻമെന്റ് ഉണ്ടോ ശ്രീകുമാരജി? ഉണ്ടെങ്കിൽ ഒന്ന് ഇങ്ങനെ കാണിച്ചേ, ഒരു തംസ് അപ്പ്. Entertainment. Okay. And labs for fever. That I told you. All those pani. Oh, inna pidicho. 3000 രൂപ. Unnecessary investigation. Routine labs. Okay, this routine lab. There's nothing. It is not at all recommended. Even USA also strongly urge no routine labs. But what is happening? Routine liver function test, kidney function test, CBC, electrolytes. No routine labs. When you do the routine labs, there will be some range outside the normal range. Then that one triggers more investigations. So routine labs unnecessary. Routine chest X-ray. No. There I learned in the hard way. My own experience, okay? In 2002, I joined a new hospital in Iowa. And suddenly, I was assigned to see only new patients. New patients every day, morning to evening, some 7 or 8 new patients. Most of them are elderly people, 60 plus. And they came for new patients. So I thought, okay, let me get a baseline chest X-ray. We don't have anything on the record but the chest X-ray. So that I thought in future, if they come with something, I'll be able to compare. You follow me? I'll be able to compare how it was before. Now, when I ordered the chest X-ray, nearly 50% of the patients, the chest X-ray report, there is a calcific nodule. The radiologist will write, there is a calcific nodule. And CT scan is recommended. He didn't have any symptoms. A calcific nodule, a 5 millimeter, and the CT scan is recommended. So now I order the CT scan. Then CT scan, it takes a part of this liver also in that picture. There is a shadow in the liver. Ultrasound is recommended for the liver. Okay, now I start, Mr. Harrison. I started with a chest X-ray. Then it went to CT scan of the chest. Then ultrasound and more workup. And the patient is worried, anxious. For me, my time is wasted, consuming a lot of my time and energy. Then after 5 or 6 days, I stop ordering this routine chest X-ray. No problem. No more routine chest X-ray. Is it interesting? If it is interesting, put I in the chat box. Is it interesting? This is a real incident. A routine chest X-ray. Okay, thank you, Alkumarji. The reason why the radiologist, because they practice defensive medicine. You know, defensive medicine is that nodule, that 5 millimeter nodule, 1 out of say 1,000 or 10,000 patients, it may be a sign of cancer. So they want to protect themselves, because if they say everything is normal and they don't recommend CT scan, then if that patient develops a cancer, he can file a case. So that is why to protect, here they use the word CYA technique. That is a cover your ass. To cover their ass, defensive medicine, all investigations. So that is what, that routine chest X-ray, I stopped. Routine ECG, this is another reason. During the discussion, I'll be glad to share more stories. During the discussion, stay, don't go away. Routine ECG, the machine reads. ECG take, there's a machine read. More than 80% of the machine read ECGs are abnormal. Then you end up referring the patient to a cardiologist. What do the cardiologists do? Okay, treadmill, angiogram, then that will lead to angioplasty, stenting. That is because of routine ECG. Over-diagnosis, over-treatment. Then comes echocardiogram. Oh, unnecessarily, most of the time. There is only one cardinal rule. One must always listen to the patient. I told you earlier itself, 80% of the diagnosis, accuracy, good history. Listen to the patient. These days, do the doctors listen to the patients? If it is a no, put N in the chat box. If it is a no, that is doctors, they don't even bother to, okay, Shanmwas, Roy Cherian, no. So that is what it is. If a doctor is too busy, don't go near that doctor. Run away from that doctor. 5-minute appointment, doctor? No, okay? Don't go. Too busy. Unnecessary stents. Again, in the USA, some doctors, cardiologists were subsequently caught for doing unnecessary stenting. They were punished. This is happening very often in India. US physicians urge end to unnecessary stent operations. This is a prestigious scientific journal, Lancet. Shut your eyes to the medical columns of the newspapers and you will save yourself many forebodings and symptoms. Foreboding means anxiety, fear. And the Kerala, Prabuddha Kerala, only in Kerala you will find Arogya Rama, Arogya Kaumudi, Arogya Bhumi, Arogyam. Am I right? So many. And there again, so many people, they, അവിടെ ആരോഗ്യ ബോധവൽക്കരണമല്ല നടക്കുന്നത്, രോഗഭീതിവൽക്കരണമാണ്. രോഗഭീതിവൽക്കരണം. You read that one, you worry. Peace of mind, don't do that. Don't do that one. You are a lay person. It is very easy to poison your mind or inject fear. Screening test. The simplest explanation is that the medical and public health communities have systematically exaggerated the benefits of early detection and downplayed or ignored entirely its harms. Screening test. Earlier, Salil Kumar was talking about prostate. That is a test also. PSA. Finally, there is the particularly misleading influence of survivor stories. I hate to say this, but the truth is most screen-detected breast and prostate cancer survivors are in fact more likely to have been over-diagnosed than truly helped by early detection. Ironically, the more over-diagnosis a screening test causes, the more people who feel they owe their life to the test, the more likely the rest of us are to have heard their stories, and more popular the screening becomes. PSA test, if you do unnecessarily, the number is high, then urologists, they will do a biopsy to find out. And biopsy, some 30 to 40% of the people, they develop after the biopsy incontinence of urine leakage. They will end up wearing a diaper, or erection problem. Their sexual life is completely ruined. So PSA test, don't get it done routinely. Is it clear? If it is clear, put C in the chat box. This is mainly the Europe. They came with that one guidelines. They pointed out this is doing more harm. Then they stopped the guidelines here. US, United States, Preventive Services and Task Force. They said, no, don't order the test routinely. Because previously it was between the age of 50 to 70, every year you have to get the PSA test done. Every year. Then I stopped immediately. And I cited US PSTF recommends no routine. That is to CYA, Venugopal, that is to cover my ass. Okay? Because somebody asked that, why didn't you order this PSA test? Yeah, the US also says nothing to add. Order. That is my CYA technique. If there are symptoms, there is blood in the urine, then yes. Or if they wake up in the night, some 2 or 3 times, sleep is disturbed, nocturia? Yes, 1 time, PSA. And depending upon the age, if it is mildly elevated, no, you don't need. The number is very high, significantly high. Then only you refer to a urologist. The normal range may be up to 4. People refer immediately 4.5, 5 to urologist. Urologist immediately, his hands are itching to do some biopsy. Okay, they do the biopsy. Don't go. Thyroid cancer again. Yeah, unnecessary ultrasound. And New England Journal of Medicine estimated over 500,000, that is 5 lakh people may have been overdiagnosed in the past 2 decades. So that only leads to unnecessary treatment, more harm. Overdiagnosis bad for you, good for business. When routine medical tests trigger a cascade of costly unnecessary care, I explained about the chest X-ray. Routine testing before surgery remains common despite low value. You don't need all the investigations for a hernia, for a cataract. Why do you need a ECG? For a cataract surgery, people order for a ECG, CBC, urine analysis. You don't need any of those tests. Should daily labs be a quality priority in hospital medicine? People who are admitted in the hospital every day, inpatient, they do electrolytes, CBC. This happened to my own mother. When she was in a hospital, when she was discharged, when I got that report, I thought every day they were testing the CBC, that is hemoglobin, every day, sodium, potassium, everything. Why? Why? Unnecessary tests, unnecessary charges, and her hemoglobin when she was admitted was 13 and it dropped to 11. Here you are drawing the blood. She was losing the blood. Over investigation. Is it clear? If it is clear, put C in the chat box. Some hospitals every day they order all these tests, raw MCG. Thank you. Money, 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 money. Nothing else. There's no indication. Overdiagnosed by self. This is what. Okay, now forget about the doctors, Prabuddha, and many other people who are a little bit computer savvy. Dr. Google. Okay. Any symptom? They go to Dr. Google. And that will give a lot of, and they people develop worry. Nosophobia or cyberchondria. WhatsApp University. Health education literature. I told you, Arogya Rama, Arogya Bhumi, Arogya Kaumadi. All those magazines. Commonly over-treated conditions, diabetes. Diabetes also, my dear friends, they come with the HbA1c. If it is between 6 and it is elevated, 6.5, diabetes. You don't need treatment if it is below 7. But many doctors, they prescribe medicines when it is only 6.6 or 6.7, 8, unnecessary. And that 7 also, keep it below 7. If the patient's age is 80, keep it below 8 only A1C. They are again tight control. It goes to 6 or something like that. It's not good. For my father, I managed his diabetes. I made sure that he was not taking unnecessary medications. When he was at the age of 85, yeah, I kept his A1C below 8. That's all. So that's one example. During discussion, I'll be glad to share more information, more stories. Hypertension. Yeah, big business. Oh, now the guidelines, they change. Yeah. Previously, it used to be 140/90. If it is top reading 140, fine. Bottom reading 90. Now they have changed. 120, keep it below 120 and below 80. If it is between 120 and 129, it is elevated pressure. 130 to 139, that is a stage 1 hypertension. Bullshit. People start treatment. And the Kribaji, Veerlakshmana Muthusamiji, he is a 80 plus. And Roy MCG, again 70 plus. And if you start a medicine to keep the blood pressure below 130 at this age, you may develop giddiness, dizziness when you get up from the chair. and you may fall and you develop a fracture and you will be using a walker. Yeah. Now your blood pressure numbers are good, but you are using a walker. It is good for the orthopedician. That is it. For my father also, I reduced. When I came there, I removed a couple of medications because he was feeling a bit dizzy. He was on 3 drugs. I removed 2 and I increased the dose of 1 medicine, and his blood pressure, I kept it below 150. No problem. He lived for another 10 years, no problem. Over-treatment, aggressive treatment, hypertension, hyperlipidemia. During the discussion, I will explain all this. Cholesterol is a nonsense business, big time business. Then dementia, yeah, many people are getting diagnosed. Old age related, some memory decline, and most of these drugs, even the cholesterol treating drugs, some drugs, they can cause memory impairment. Side effect of that one. Then dementia, you get another treatment for dementia medicine. Once that label, dementia ആണ് കേട്ടാ. മിക്കവരും നിങ്ങളുടെ സംസാരിക്കാൻ വരത്തില്ല. കഴിച്ചാൽ ആർക്ക് ഡിമെൻഷ്യ പിന്നെ എന്നിട്ട് സംസാരിച്ചിട്ട് വല്ല കാര്യമുണ്ട്? വേണോലജി ആർക്ക് ഡിമെൻഷ്യയാണ് വരത്തില്ല സംസാരിക്കാനായിട്ട്. So that is a problem. Overdiagnosed and overtreated. Previously, we used to say medicine is art and science. What exactly is medicine now? We are going to see my own quote. Business and profit. Do you agree? If you agree, A in the chat box. It's no longer art, no longer science. It is a business, profit, corporate hospitals, shareholders, target. A doctor is getting a salary of 2 lakhs. The doctor is expected to generate at least 4 to 5 lakhs. How do they generate? Unnecessary investigations. Don't go to all the specialists directly. Choose either a experienced MBBS doctor, not a fresh MBBS. If you find an MBBS doctor who is 50 and above, go to that doctor, or just an MD, general medicine doctor. Don't go directly to a neurologist, gastroenterologist, all this. Gastroenterologist, immediately they will put a tube. They immediately want to see your stomach. Okay? Endoscopy. Endoscopy guaranteed. 90% of them. Don't go. I've shared some practical, useful tips. Upcoming talks: mental dry cleaning, power of smiling. Okay, did you find this really enlightening? If it is really enlightening, put RE in the chat box. Thank you, Roy MCG. And I'm sure that you have learned something new, useful, practical. Now I'm going to stop the recording. Don't go away. Stop the recording. I'm going to stop the recording. Salkumar, then you can have a discussion. We can have discussion.
Doctor, no. ഒരു ഗസ്റ്റ് ഉണ്ട്. അനന്ത് പുള്ളി ട്രിവാൻഡ്രം പഠിച്ച പോലെ ഫൈനൽ ഇയർ ഒരു ടോപ്പ് സ്കോററാണ്. അനന്ത് ജോയിൻ ചെയ്തിട്ടുണ്ട്. ടോക്കിന് പുള്ളി ഉണ്ടായിരുന്നു. He's waiting for
Okay. Yeah, I'm going to stop the recording and we'll have discussion, follow-up session. Thank you.